Okay.
All right. Okay, everybody, we are going to be demonstrating the Aorta IVC protocol. And the purpose of this video is so you can see probe placements, pay attention to my labels, pay attention to the anatomy that is required for each image. So I'm using my curved probe, my curvilinear probe, and I'm on my abdominal setting. So before I have my patient take in any breath or anything, I'm going to put my probe sagittal plane, so my indicator is towards my patient's head, and I'm going to start at the xiphoid process. And I'm just going to take a look at my screen. So let me adjust my focus and my depth and see if I like my settings. TGC. Okay, so here's my left lobe of my liver, and here's my aorta. So please take a breath in and hold it. So when she brings that breath in, she's going to push that diaphragm down, and I'm going to see my proximal aorta a bit better. So once I like it, freeze. Okay, breathe. Label. Aorta, sag, prox. And then I'm going to measure. Caliper placement including the walls of the aorta. Remember that this is your diaphragm, here's your left lobe of the liver, and here are the first takeoffs, the first branches of your aorta. So proximal is going to be anywhere from this region towards the diaphragm. Next image is going to be aorta transverse prox. So I'm going to turn my indicator towards me. I'm still in the same spot. Take a breath in, please. All right, so I'm going to sweep up towards the liver and start coming back down. I can see my IVC here, and I can see my aorta. So I'm going to keep coming a little more inferiorly until I can see that nice round aorta before any takeoff. So here's my first takeoff here, my celiac axis. So I'm going to scan superior to that and freeze. So here's my transverse prox, and I'm going to measure. That's good. Okay, my next image is going to be sag mid. So same spot, I'm going to go ahead and turn my indicator up again towards my patient's head, find my aorta. Now I'm going to look for my anatomy. Again, here's left lobe of the liver, here's my aorta, here's my first branch, and here's my second branch. So my first branch is my celiac axis, my second branch is my SMA. So I'm going to scan a little more inferior, change my focus and my depth. I may not have to have my patient breathe in for this, because remember we're coming toward the midsection. So not all the time do you have to have that diaphragm pushed down anymore. Okay, please. So if I measure from here to superior, that's going to be incorrect. If I'm at mid, I have to measure from this SMA takeoff and inferior. Okay, next image is going to be transverse mid. Probe's in the same spot, indicator towards me. So now I'm going to look for those takeoffs. So this is my IVC, here's my aorta, and I can see my celiac axis, my celiac trunk branching off of the aorta. So this vessel here is going to be my hepatic artery. This one traveling off towards the left is going to be my splenic artery. So I'm going to come down a little bit more. My next takeoff is going to be my superior mesenteric artery. You can see this little round vessel anterior to the aorta. So I'm going to come down a little bit more, a little more inferior, and freeze it. So here you can see aorta. Here's my spine. Here's my SMA. Take that and measure in the transverse plane. Next image is going to be aorta sag distal. Turn my indicator up towards my patient's head again, and I'm going to come down the abdomen following the aorta. Now remember, as you get more distal on the aorta, it's going to become more anterior in your patient's body. So I'm going to change my settings, my focus and my depth. I do not have to have my patient breathe in because I am so distal on her abdomen. That's not really going to help me so much. I could see it just fine, just like this. So where the vessel starts to narrow into that bullet shape, that is your distal aorta. So I'm not going to measure here where it gets very narrow because that's going to be the beginning of the iliac. I want to measure just where it's starting to narrow into that bullet shape. Next image is going to be transverse distal. So I'm going to go transverse right here. I'm going to follow my vessel down until I see the split of the bifurcation. There's a little bit of gas there, so I'm going to try to hop over it. So I can see my bifurcation right here. I'm going to put a little bit more pressure to try to displace that gas. So now you can see I can see it a lot better versus if I had less pressure. See, less pressure, gas is in the way. More pressure, I'm displacing that gas. So I'm going to come back up just superior to the bifurcation, and there's going to be my transverse distal. And measure. Okay, next image is going to be sag bifurcation. Okay, so what I'm going to do is go back sagittal, find my vessel. There it is. So to get that bifurcation, we're going to come off of midline and then angle back towards my vessel. So I'm going to keep swinging my flashlight until I start to see that split. So if you are, again, you're midline, right on top of your vessel, there it is. So I'm going to come off of midline, and then I'm going to swing my beam back towards that vessel, and here it is. You can see the split. Hopefully you can see that. Sorry, is that hurting? That's a lot of pressure. All right, your vessel should be more anechoic, so I'm going to try to clear out some of those echoes. So here's my bifurcation. We do not measure on the bifurcation, you're just showing it in sag. So now my next image is going to be transverse bifurcation. So again, I can go back to midline, follow my vessel down until it splits. I can see it a lot more easy now without so much pressure because the bowel has shifted. And transverse bifurcation. One picture without measurement and then one with. So if my indicator is towards my patient's right, then my right side of the screen is the right iliac, and the left side is going to be the left iliac. So I'm going to go ahead and measure both iliacs. I'm going to measure the right one first, and then measure the left. And then I'm going to label each one. RT and LT. Okay, last image of our aorta IVC protocol is the IVC. So, IVC, sag, and remember that the IVC originates where the iliacs converge together and then it travels up the abdomen. So this portion here is actually distal, IVC. Okay, distal. So because here the vessel was more anterior and I'm coming back up here, and now the vessel is going to be more posterior, so I need to bring down my depth so I can see my anatomy again. So I'm going to start over. Indicator towards my patient's head. I'm starting at the xiphoid process. I'm going to find my liver. I'm going to find my aorta, and if I know that my IVC lies to the right of the aorta, then I'm going to swing my probe towards the right of midline, and there is my IVC. Can you take a breath in, please, and hold it? Remember, taking a breath in is going to compress that vein a bit. But actually, go ahead and breathe. So I waited for it to open up, and there it is. So IVC, sag, distal, and then we'll do one with color just for fun. So again, if I bring up my color box and you see a whole lot of flash, we can change our filter, we can change our scale, but I'm going to just turn down my color flow gain and see what that does. That cleans it up real nice. If I want to adjust the size of my box, I'm going to hit this top button here and adjust the size. take a little breath in, like half a breath in and hold it. So see how her breathing in compressed that vein. So if I'm ready, if I have all my settings ready, and then I let her breathe, go ahead and breathe. Of course, it didn't work the way I wanted it to. Ideally, it would have filled in that vessel. That's okay, breathe normal. Okay, that's pretty decent. IVC sagittal. So that is the end of the aorta IVC protocol on a normal patient.